The vertebral column is composed of 24 individual vertebrae, and this varies. It's not as many, or it's actually more when you are in development as a fetus, and the number reduces once we are born. There's variations in number when present, definitely in the inferior half of the vertebral column. The vertebral column does all kinds of important things for us. It provides the vertical support of the body, supports the weight of the head. After all, the skull is very, very heavy and would actually collapse on its own weight without all this extra support. Maintains an upright body position, transfers the weight of upper limbs or upper body to lower limbs. Most importantly, it protects the spinal cord as there are holes in the vertebrae for the spinal cord to go through, and it provides passageway for spinal nerves. And we'll see some of those bone markings coming up. The divisions of the vertebral column are that there are 7 cervical vertebrae. You need to know the numbers, C1 through C7. Vertebrae are named for the region of the vertebrae and then the numbers. So C1 through C7. The thoracic region of the vertebral column has 12 thoracic vertebrae, and they are numbered T1 through T12. They kind of form the upper back region, and each thoracic vertebrae forms a joint or articulates with a pair of ribs. The next section of the vertebral column is 5 lumbar vertebrae, and they are named L1 through L5, and they form the lower back. The next region down, the next inferior portion, is called the sacrum, and it's S1 through S5. However, once we're born, they are fused sacral vertebrae. During fetal development, there are 5 separate bones. And then beneath that is the coccyx, which is the tailbone, and it forms 4 coccygeal vertebrae named as CO1 through CO4. And again, those begin to fuse during puberty. So by adulthood, we have a total of 24 vertebrae. Looking at the vertebral column on this diagram, the first thing that I'd like you to notice is that the spinal column is not, or the vertebral column is not a steel rod. It's incredibly flexible, and we are born with certain curves already built in. So if you think about the things that children have to do, that babies have to do, is they have to learn to hold their head upright, then they have to learn how to walk. So the thoracic curvature and the sacral curvature are what we refer to as the primary curvatures. They are the curvatures that are already present at birth. As we develop, as children develop, as they learn to hold their head up and learn to walk, there is another curvature that is developed, and they're called secondary curvatures because they develop within the first few years of life. I'd like you to notice the names of these vertebrae again. So C1 through C7. It's only the first 2 vertebrae which have their own names. Specifically, C1 is called the atlas. C2 is called the axis. On C7, there's a specialized bone marking called the vertebral prominence. Then sticking out of most vertebrae towards the lateral direction is a process called the transverse process. And in the second portion of the vertebral column, we find 12 thoracic vertebrae. The body is the region of the vertebra which holds the majority of the weight, and it's actually thickest in the lumbar region. You can see how thick these bodies are compared to bodies that are in the thoracic region. Found between the vertebrae are intervertebral discs, which are made up of fibrocartilage. Most vertebrae have what's called an intervertebral foramen, and in this instance, these are important foramen for spinal nerves to go out towards the periphery. On the very posterior region of each vertebra would be the spinous process. And when you put your thumb on the back of your spinal region, the point that you feel sticking out is your spinous process. And this is the 5 lumbar region, L1 through L5. The sacrum is 5 fused cervical vertebrae, and the coccyx is 4 fused coccygeal vertebrae. So the spinal curvatures are shown here. The primary curves, as I showed you in the previous slide, are in the thoracic and the sacral region. The secondary curvatures start to form about 3 to 4 months of age, and the cervical curvature develops as the baby learns to hold their head up, and the lumbar curvature starts to form as they begin to walk. So the 4 spinal curvatures present in adulthood would be the cervical curvature with 7 vertebrae, the thoracic curvature with 12 thoracic vertebrae, the lumbar curvature with 5 vertebrae, and then the sacral curvature. So the vertebral anatomy shows some of these important parts that we're going to look at next. The body is the thick weight-bearing region of a vertebra, and its adjacent bodies separate the pad of fibrocartilage, which acts like a shock absorber, and that's, of course, the intervertebral disc. The vertebral arch attaches to the body and forms the vertebral foramen. And the foramen is the hole for the spinal cord. So again, those vertebrae have the important function of protecting this important neural tissue. Coming off of the vertebra are pedicles, which are feet of the arch, laminae, posterior extensions of the arch. The stacked vertebral foramen form the vertebral canal, and on the side are the intervertebral foramina for spinal nerves. The vertebral canal is for the spinal cord itself. Other parts of the vertebrae include the spinous process, which projects posteriorly. That's what you can feel when you palpate the back of your spine. The transverse process, which projects laterally. And at the bottom of the vertebrae are inferior articular processes. At the top are superior articular processes. And each of these processes have a smooth articular facet, which forms a joint with the vertebra above or below it. So in this image, we can see a typical vertebra. I want you to notice the body. It's the thickest part. It's going to be pointing anterior in the anterior direction. The part that you can feel on a person is the spinous process. Pointing out to the sides are 2 transverse processes. There's one pointing here and another one pointing here. The vertebral arch is formed by the lamina and the pedicle. The pedicle is in this region, and the lamina is between the spinous process and the transverse process. And then pointing in a superior direction is the superior articular process with a facet on top of it. And then the vertebral foramen is where the spinal cord is going to be located.